So if we could bring people back to some non-hospital admission, observed setting, whether it's go to the ED for a 1-hour visit or a half-hour visit, or an observation unit, or an outpatient infusion center, does this make sense? Is there an advantage to this?
I think there is. I think the key is selecting the right patient. Deciding do they truly need a parenteral, an IV antibiotic, and then looking at compliance, adherence, looking at other factors. But I think for certain patients, it's an excellent option.
Well, hospitals are great when you need them, but you have to remember hospitals are very problematic when you don't need them. And I'm not talking just about cost now. I'm talking about the risk of getting infected with a hospital type of pathogen, because you're in a hospital, you have a Foley catheter, you have a vascular line, and all of those can be infected. All of those serve as sources for infection. It's, you get in a hospital, you lie in the bed, you're not as active as you would be when you're at home, you develop a DVT, you become confused, you vomit, you develop aspiration. We all know how it goes. And so hospitals are only good if you actually need them. And so if you can avoid them, it would be the best for the patient as well. And so I think that we are entering an era in which we are trying to avoid hospitalization. And skin infections, I think, was one of the very first type of conditions where people developed programs of hospital admission avoidance. And it was actually starting in the West Coast and kind of disseminated throughout the country.
Yeah, and I think if you take that even further, look at patient satisfaction. It's a very hot button topic these days. And
in the C-suite.
Oh yes, yeah. Absolutely, right? So, if you look at these patients and you look at studies, so, acceptance of this is very high. Patients love it. I've been up to our infusion center. Unfortunately, we've had to evacuate for hurricanes in Savannah, Georgia the last 2 years. That's where I go up and sleep. They have these leather chairs, they fold all the way back, you get a snack, you have a nice little flat screen television. I get it.
You have been a house officer in the past far too long.
I know, right?
You're sleeping in an infusion center.
I know, whatever it takes, right? But they're nice areas. I think that's the key takeaway. So patient satisfaction with this is very high.
Okay, could it be not a cost center, but a revenue center for a hospital? What's the reimbursement like for coming to a brief visit to an ED or an outpatient infusion center, getting your antibiotics and going home?
I think that's the big difference. If it's an outpatient, whether it's ED or whether it's an infusion center type setting, you can now bill for the drug, you can bill for the visit. So there are cost generation sides of it from looking at that. So
far from being a DRG sink, if you have this facility where you bring people back, you can make money on this.
Oh, absolutely. Absolutely. And I think in fact this is the business of a lot of infectious disease doctors. When you shift inpatient into the outpatient setting, you provide new opportunities. And one of them is, as you know, unlike in an inpatient setting where we don't get reimbursed for antibiotics that we infuse, you actually get reimbursed for antibiotics, and you also get reimbursed for the administration of those antibiotics. And so, yeah, there are opportunities for care providers as well by doing actually the right thing, which is providing treatments that do not need to be given in a hospital out of the hospital setting.
It also occurs to me that if patients have to come back and you say, please come back and we're going to see you, and if they miss an appointment, you know it, then compliance is better, and that's got to be better for society.
Absolutely. I think that's a big part of it. To be able to know, especially with some of the newer agents, to be able to know they got their full dose of an antibiotic in one setting, it takes compliance and adherence out of the picture.